Coming up, the coronavirus pandemic in 2021. We're taking a look back at the year, hearing from survivors and health experts. I'm Aaliyah Chavez. Join us for these interviews from Indian Country Today.
The Walter Cronkite School of Journalism and Mass Communication at Arizona State University is honored to be a supporter of Indian Country Today. Working with award-winning professors, Cronkite students learn news reporting, social media, shooting and editing videos, and producing content for communications industries. Cronkite's 15 professional programs give students the opportunity to cover critical issues throughout the U.S. and beyond. Learn more at cronkite.asu.edu.
This is Indian Country Today.
Amarawa Hopa, thank you for joining us. As we near the end of 2021, we reflect back on a full year battling the coronavirus pandemic. Let's start in New Mexico to learn about 4-year-old Stella Martin. A round of applause for one tough girl. This video comes from an Albuquerque hospital where dozens of people gave 4-year-old Stella a hero's farewell after her recovery from COVID. She was hospitalized for 8 months after her severe battle with the virus left her paralyzed. Stella's mother, Cassandra, says in April, Stella complained of back pain, then went limp in her mother's arms. She was immediately rushed to the local hospital, but later had to be airlifted nearly 200 miles away. It was at the University of New Mexico Hospital where Stella was cared for, including by one doctor who was there from day one.
She felt like a child to me, not like my own child, not a patient anymore.
Dr. Hadid says Stella now has a condition called Acute Transverse Myelitis, which happens when the body's immune system attacks the spinal cord. It can happen after a reaction to an infection. In this case, COVID-19 was the trigger. Unfortunately,
you don't, so a lot of times in these cases, you might not see even close to full recovery. So I'm hoping that
Stella's family now will be learning how to care for a paraplegic, and this comes as they are still healing from her father's death from the virus in April.
Whatever little thing is out there, we're still going to be positive and still try to help her fight that she needs to fight for, because she's only 4 years old and she's inspired so many people right now.
Typically, COVID-19 doesn't strike children as severely as adults. But Stella's family encourages people to still take precautions for children, for elders, and for community.
Be very protective of your children because a lot of things can happen to them, and some of them don't get as lucky as Stella.
Instead of the usual nurse or aide, Dr. Hadid pushed Stella's wheelchair to the elevator and sent her off with a very special message.
Stay strong and come back only to visit us. You're not allowed to get sick.
In Albuquerque, New Mexico, Aaliyah Chavez, Indian Country Today. Shortly after Indian Country Today reported Stella's story, her mother Cassandra set up a fundraising account for those wanting to help. In the end, more than $38,000 were raised for Stella. When we come back, we learn about another COVID-19 survival story. This one from a Chickasaw doctor who contracted the virus when caring for his patients.
This is Indian Country Today.
Chickasaw doctor Joseph Lashley had been among the other healthcare workers at the front lines of the pandemic. In April 2020, a month after COVID ramped up in the United States, he says he began feeling sick. He describes what happens next in an interview earlier this year with ICT editor Mark Trahant.
Maybe walk us through how it all started and the process.
Well, sure. We were all learning about the COVID. It was coming into more of a common thing that we're starting to hear about in the news. We knew it was in our area. And so each day we'd go to I worked the ER at nights, and each night we discuss with the staff the plan. Everybody stay safe, everybody wash their hands, wear as much of the personal protective equipment as we could, but treat every patient like they may have it, because it's invisible. You don't see it. You don't know who has it, until a test comes positive. So that's the way we went after it, to keep our whole staff. And my group really worked well as a team, but our plan was to keep everybody safe, not just the doctors, but the nurses staff, the housekeeping staff, the laboratory staff. So, once again, our area hadn't really tested positive yet. Nearby areas had. We knew it was coming. And then over the next couple of weeks, we started having some positive tests. Once again, I would be called upstairs to the ICU for somebody who had passed away from COVID-19. And during that time period, they're breathing heavy, they're actually dying. And so, but the virus stays in the air for a little while. And so it's still there. So we had rules and regulations about waiting to go in after, somebody expired. But once again, the virus was still there. And once again, I'm not sure at the time period we had the best personal protective equipment yet, but we had the time what we could use. So, each day at work was a little scary thing. My wife's a physician as well, and we'd have a family talk. Mom and dad are trying to stay safe. Mom and dad are trying to protect the family and each other from this. So we'd take our clothes off at night when we get home. We'd, sanitize all of our lab coats and scrubs and clothes and shoes. But once again, as I told my wife, we're not ones that run away from a fight. So when it came to us, we were ready, we were after it. And I wouldn't have changed that now.
A few days after seeing patients, Dr. Lashley says he began feeling sick. He had tested positive for COVID-19. He stayed at home for the first couple of days until his wife noticed his oxygen saturation levels were low.
So I talked to my wife and she said, listen, I know you don't feel bad, but your saturations are a little bit low. Let's be safe and go with a COVID unit at a local hospital and be watched for a day, and then you can come home and quarantine. I said, well, you're the boss. So we went to that, and within 24 hours of being there, my saturation started dropping. They went down to around low 80s, and that's when they came and said everything's changed. You need to be put on a ventilator. And so the nice doctor came up from the emergency department and said it's got to be done. And my response was, no, my wishes are not to be intubated. And they said, your wife says you're not in your right mind right now. She says, intubate you. So that was a big joke we had, but it was a right decision with 3 young children. And so that's the last I remember for 39 days. They intubated me. And once again, that's when, everything changed in my world. But, now retrospectively, what really changed was my family. My wife and my kids now had no dad for the next 39 days.
Wow, that's extraordinary when you think about it. You don't even realize the fight you're having because you're not present.
Correct. During that time period, they had to put a tube to breathe for me. It's called a trach. They had in that time period, I had dialysis twice where they, clean the blood like they do for kidney patients. They, I had a stroke, and once again during that time period, what they do is they put me prone or face down to activate the lower parts of my lungs that weren't working usually when you breathe. You don't use them that much. Once again, I don't smoke. I don't have any chronic problems. Wasn't on any medicines before any of this. And so, the hope was that by supporting my breathing, I'd get better. But each day, actually, I got worse. And so my wife kept meeting with the specialists. And at the time, we said, don't give steroids, which is now the first thing we give people because they thought it would make the virus more productive. And but once again, things were getting worse. The pressure to keep my lungs open was getting harder for the machines. And once again, they said, this is not looking good. Around Mother's Day 2020, the critical care doctor asked my wife to please consider taking me off of life support. And once again, that was a shocker.
Dr. Lashley survived his battle with the virus, and his road to recovery was difficult. He later said he needed to work with physical therapists to get back on his feet. We're happy to report that in April, Dr. Lashley fulfilled a goal, which was to visit the Grand Canyon in Arizona. He walked around the national park with his wife and children. We'll be right back.
This is Indian Country Today.
Across Indian country, COVID presented new challenges for tribal leaders. One of those tribal leaders is Acoma Pueblo Governor Brian Bayo. He joined the ICT Newscast in July to give us an update on how the virus impacted his community. Here's part of his interview with Mark Trahant.
I'm really grateful for the tribal community really sticking together and following the rules. It was a great sacrifice on the part of the entire community to ensure that we were all safe. We were impacted in a big way for our population. We have about 5,100 tribal members. About 3,700 of those tribal members live on the reservation. And a total of about 450 tribal members did contract the COVID virus. And unfortunately, we did lose 23 tribal members. So it took its toll. And of course, with our executive order and stay-at-home restrictions, it prohibited us from being community, and really being Acoma people, and in terms of our engagement with culture and our own life way. But I'm really grateful that we've reached herd immunity. We about a month and a half ago, and we have not had any positive COVID cases for nearly 4 months now.
In 2020 and 2021, Acoma Pueblo made sure to continue its cultural traditions. It did so by producing a first-ever virtual feast day on Facebook. The tribe also organized dancing and socially distanced ways to share food. In February of 2021, we interviewed Chickasaw citizen Nicole Willis after her entire family came down with COVID-19. At the time, she said the virus gave her a dull headache and a loss of taste that lasted for weeks. After recovering, she wanted to tell Native people to take care of themselves.
One, absolutely make sure you're taking care of yourself and your own mental health. There is nothing wrong with reaching out to talk to someone, even if it's a friend, a family member, call someone. If you're struggling, definitely reach out and share your struggles. And there's so many that have had it now that have, recovered from it. And everyone's story is different. And so it has been really helpful for me when I reach out and talk to other people to understand, this is how it affected them and how it's affected me. And also just not only the idea that I'm young, I'm healthy, this isn't going to bother me. That's not true. It's just, it's very strange the way that the virus impacts your body. And so even though you think that you may be young and you may be healthy and you don't have any underlying conditions, that doesn't mean that you're not going to struggle with it. So I would really encourage everyone to do everything that they can to keep themselves safe and their family safe.
That was Chickasaw citizen Nicole Willis. Up next, we'll hear from experts in policy and the medical field.
This is Indian Country Today.
When COVID hit, the U.S. government passed emergency laws to help citizens get through the financial hardships, and that ended up resulting in tribal nations getting major aid. The CEO of the National Congress of American Indians explains.
We've had the multiple relief efforts that have included Indian country. It's not a question anymore of whether or not you include Indian country. It's a question of how much you include Indian country. And one of the remarkable things we've seen from the CARES Act to the American Rescue Plan is the inclusion of Indian country of discretionary funding. This is an elevation of our governments and a rightful recognition of having tribal leadership make the decisions that are appropriate for their communities. And I think when we look back at this time, we're going to be looking back at this discretionary funding as a real turning point in self-determination. So it's great to see the involvement of Natives in this administration, the higher level impact they're having, but also seeing things come together in Congress and the administration.
That was the CEO of NCAI. Now let's go to Minnesota to visit with another physician who has been on the front lines of battling COVID. In March, ICT editor Mark Trahant spoke with Dr. Mary Owen about how the pandemic could potentially impact the number of people going into the medical field.
Dr. Owen, I've been reading a lot about 1919 and how it changed things. And one of the extraordinary things about that era is that it spurred people to go into medicine. Do you think we'll see that again?
It's funny because we saw more, and I don't think it has to do with that COVID vaccine, but we saw more applicants this year than we have in a long time at our medical school. But I think that's more due to this on being able to interview online, and so not all that cost to travel, which we need to bring. A lot of these ideas that came because of necessity need to be brought into the future. Maybe we'll get more Natives in medicine, and again, because of that caring for our community that we know exists amongst us. I'm hoping that that's the case because we certainly need it. In the Bemidji area where I work, there's a 46% vacancy rate for physicians. Additionally, nobody knows us like us. We have this shared history of genocide and trauma, and also more of us know about the social determinants that our communities are faced with, high rates of poverty and education issues from for many historical reasons.
That was Dr. Mary Owens. Dr. Owens mentioned that Native people going into medical school is an advantage because they know Native communities well. One example of that is Victor Lopez Carmen. Victor is a third-year medical student at Harvard University. I spoke to him last month and asked him what it feels like to be a doctor in training during COVID.
Yeah, being a medical student during COVID, I don't know anything else. It was my only experience. I don't really have much to compare it to, but it was, I think for me, not black and white. I can't say it was all bad or all good. Part of, the difficult part was sort of being sent home in the middle of very intense training and studying, and having to navigate, being able to study and retain the same amount of knowledge that I'm being taught over a computer, especially knowledge that I'm going to be using that is going to really impact people's lives.
Victor, can you tell us if you've taken care of COVID patients, and if so, what was that like for you?
Yeah, I've helped taking care of COVID patients many times. And it was a big discussion of whether the medical school would have the medical students do that, but they saw it as a moral responsibility because we're going to have to take care of COVID patients. We're going to have to learn how to take care of these patients, and that's important to our education. But we're always given the choice. We're always asked, are you okay with seeing a COVID patient? And most of the time I said yes. Sometimes maybe before, when in the beginning, when, a lot of research was still coming out on the vaccines. I may have refrained once or twice, but after I got the vaccines, taking care of the COVID patients was, I think, pretty formative for me in that I was able to answer a lot of questions, also learning about my patients, but from family members and people from community who may have had a lot of questions about the vaccine, about COVID symptoms, what should they do if they start feeling bad. I was able to be a resource to my community in that way from what I learned in the hospitals with COVID patients as well. And I think that was a good thing for me to do.
That was third-year medical student Victor Lopez Carmen. Last month, Victor was named a recipient of Forbes 30 Under 30 Award for his work advancing Natives in medicine. Let's go now to the acting director of the Indian Health Service, Elizabeth Fowler. Here's a May interview with Mark Trahant.
What have we learned about the collection of data during this pandemic?
Well, we've learned that there are a lot of inconsistencies out there. We've learned that it would be very helpful for states to collect data to a more granular level to help us understand the healthcare that was being accessed through the states versus through the Indian Health Service, in order to help us just know the coverage of vaccine for our population. It works both ways. States were interested in knowing how successful the programs were that were receiving vaccine through the federal jurisdiction and how that contributed to the state's performance, as well as tribes wanting to understand how many of their members were accessing the vaccine through other channels so that they knew how much of their tribal membership were covered by the vaccine, so they could be assured of what their status was in terms of vaccination levels.
There's a lot of parts of the system that remain in rural areas, and in rural communities, there might not be dual health systems, that IHS might be the only provider available. Has that been a lesson in the pandemic, that things spread quick and it's got to serve everybody?
Oh, definitely. You know, being part of a community, it was so important for us to protect our patients, our beneficiaries, not only within the patient population, but acknowledging that they were part of a community. They interact with grocery store cashiers and the post office workers and other dog groomers and anyone and everyone out there who may not be American Indian or Alaska Native and part of our patient population, but all the same, protection of our patient population just goes hand in hand with the community. And so we use a term called community immunity. We want to achieve community immunity because that will afford our patient population the best protection.
What lessons from this will strengthen the Indian health system?
Well, practicality leads me to say that, the Indian Health Service, we really need to ensure that we are using the lessons learned to help people understand how appropriations are used effectively and how there has been a chronic underinvestment in our Indian health programs. So I think that's the first, because it's so significant. We were not prepared well or positioned well for the pandemic in terms of our infrastructure. And so I think that is one of the lessons learned that is particularly important. But I think just understanding how the flexibility that was afforded and how important it is to have the tribal leaders making their own decisions about their communities was also very important.
That was Acting Director of IHS, Elizabeth Fowler. We'll be right back.
This is Indian Country Today.
David Wilson was named the first director of the Tribal Health Research Office at the National Institute of Health in 2017. He leads health research about Native people. During the pandemic, he has collaborated with top experts, including Dr. Anthony Fauci, to ensure Native communities are included in pandemic research. In our October interview, he told me how experts are already studying the effects of the pandemic, even though it's not over yet.
So across the NIH, we are really preparing for what comes after the pandemic. Because of isolation, we've heard and we've seen a lot in our communities what isolation has done. And so there's going to be a wave of issues related to mental health conditions. We're already seeing a rise in issues related to suicide and also substance misuse. So these are all really important factors that really are detrimental to our communities. So it's important to better understand how we can treat members of our community to address these conditions so that we can have better communities across the country.
Wilson has a message for those watching.
What I want our people to know who are watching currently is that you definitely have the power to help save lives in your community. Not only in your community, but with your friends, your family. And it's important to get your accurate information out to your friends and family. So when people don't have accurate information or are misled by something that they see on social media, it really turns them away from making decisions that could potentially save their lives. And we have to fight against that. And we do that by sharing the truth, by sharing our experiences, and by pointing to people and to credible sources that are out there.
And that's a slice of our Indigenous world. Thank you for watching. For all the latest news and updates, visit us anytime at IndianCountryToday.com. I'm Aaliyah Chavez.
Sometimes you got to take a stand just because you know you can. Oh, you got to run, you got to run.
This is Indian Country Today.